with the topic which is called as diverticulitis. So before moving into the topic of diverticulitis, we should understand what is diverticulosis. So diverticulosis is an outpouching in the large intestine which can happen anywhere within the large intestine, but the most common area is sigmoid colon. So where is the sigmoid colon? When you look back into the anatomy, the sigmoid colon is in the left lower quadrant. When you think about the large intestine, it's just like an open box. So starting from the right and ending in the left. So starts with the ascending colon, transverse, descending, sigmoid colon, and then the rectum. So this is how it works. So in the left lower quadrant, we have the sigmoid colon. So this outpouches can be most commonly because of constipation. So because of the consumption of low fiber diet, the stools can become hard and thick, and that leads to a difficult defecation, so which lead to an overstretching of muscles in the sigmoid colon, and this leads to an outpouching or a herniation, which is diverticulosis. This diverticulosis is asymptomatic and it is painless. But whereas when these pouches get strapped with foods or nuts, that is when this leads to an inflammation. So when the patient has an inflammation, that is diverticulitis. So this diverticulitis is painful as well as it is serious and needs an immediate medical attention. So let's move on to the signs and symptoms. So we will learn the signs and symptoms as pouch. So P stands for pain. So pain, where will be the pain? It will be in the left lower quadrant where the sigmoid colon is located. So the pain will be in the left lower quadrant or in the left iliac fossa. This pain can aggravate if the patient has any activities which can increase the intra-abdominal pressure, such as coughing, lifting, sneezing. So all these can aggravate the intra-abdominal pressure, and that can even aggravate the pain as well. So O stands for observed bloating. So one of the most common symptoms is flatulence or increased bloating. So and also observe for blood. You have to also observe if the patient has got any melena, which is blood in stools. So U stands for unrelenting or continuous cramps. So if the patient would have severe cramps, especially if there is a peristaltic movement. Then the C stands for constipation. So the patient can have either diarrhea or constipation, but the most common is constipation. And the H stands for increased temperature or high temperature. So that are the signs and symptoms of diverticulitis. So now move on to the management. The first management is bowel rest. So the bowel is inflamed, the large intestine, the sigmoid colon area is inflamed. So what the bowel needs is a complete rest. Keep the patient nil by mouth, commence the patient on IV fluids, and even you can give clear fluids. Clear fluids like jello, broth, apple juice. So all these are the clear fluids. So also we will advise the patient to be on bed rest because increased activities can lead to increased peristaltic movement, so that can again aggravate the pain. We will also treat the patient with antibiotics as well as analgesics, and we have to prevent the patient constipation. But keep in mind, no enema, no laxatives, because it can lead to rupture of these diverticulosis or the pouches. And avoid seeds, fatty foods and red meat. The patient does not have to completely avoid seeds, as well as there was recent studies, but the patient has to get rid of these things when it is acutely inflamed. So when the acute state is resolved, then the patient can consume seeds as tolerated. So always remember, with the diet, diverticulosis, the patient needs to have high fiber diet such as brown rice, fresh fruits and vegetables, oats and grains. So in this case, the patient needs to prevent diverticulitis. So hence, the patient needs to consume high fiber diet. Whereas in diverticulitis, the patient needs to consume low fiber diet such as cooked or skinned fruits and vegetables, white rice, but no fresh fruits or vegetables. So this you have to keep in mind. Moving on to the complications, one of the main complications is perforation. So as this pouches enlarges, the arteries could rupture, and that can lead to perforation. So if the patient has perforation, the patient will exhibit symptoms of shock. The another complication is peritonitis. Peritonitis most commonly occurs because it can lead to abscess formation, and this abscess, once it is ruptured, the contents of this abscess can move into the abdominal cavity, and that can lead to an infectious peritonitis. So if the patients end up in peritonitis, the patient will have rebound tenderness, increased pain, increased bloating, as well as tachypnea and tachycardia. So this is all about diverticulitis. We have covered the important points. For more NCLEX related sessions, please join MedWorld Academy. Thank you so much.